My name is Dr. Malem, and I would like to talk to you about bedwetting and how to cure it. When you think about it, bedwetting is not an illness or a disease. We all start life as bedwetters, and we all learn to become dry. It is a skill which we acquire in the same way we acquire the skill to talk, walk, ride a bicycle, swim, etc. It is a natural process. Sometime after the age of 18 months, children learn to become dry naturally. By the age of 5, 90% of children are naturally dry. By the age of 10, 95% of the children. And by the age of 13, 98% of children are naturally dry. 2%, unfortunately, remain wetting into adulthood. So the old phrase, "don't worry, they'll grow out of it," has got a lot of truth in it. The problem is, if you have a child who is wetting the bed, you don't know whether he's going to be lucky within the 15% chance of becoming dry per year every year, or one of the unlucky ones who could be wetting into adulthood. So it is important to take bedwetting as a serious problem which deserves to be treated and sorted. When you think about, if you have a child who's wetting the bed, it is obviously a problem. And basically it is two problems. One for the child, because it's socially unacceptable to wet the bed, and one for mom, who has the burden of having to change the bed, wash the sheets, and so on. So really it is two problems. And mom looks at problem purely from her point of view, and her main concern is to have a dry bed in the morning. So she will do anything she could think of to achieve that end. And the most common things are stopping the child from drinking, so restricting fluid intake. Lifting the child, so mom, before she goes to bed, she carries the child while they're asleep, takes them to the toilet, and empties the bladder. So it's lifting them before she goes to bed to empty the bladder. Also using nappies and pull-ups, obviously protecting the bed as well. None of these things do any good for the child at all. If they achieve anything, they achieve a dry bed and please mom, but they are not anything which will help the child become or speed up the process of becoming naturally dry. And one of the very common things, if you ask a mom who has got a child who wet the bed, very often they tell you he or she is lazy, they don't wake up, they sleep heavily, and so on. And really there is no scientific link at all between deep sleep and bedwetting. Bedwetting takes place throughout sleep, throughout all stages of sleep, not specifically during deep sleep. And the thing to bear in mind is 80% of children, when they are sleeping at home, will not wake up to a fire alarm. So the thing to bear in mind is that when a child is sleeping at home, it is a safe, secure environment. They know that their parents are looking after things. They don't have to worry about locking the house, answering the phone, or doing anything. So when they sleep very, very soundly. Mom never tries to wake up the child who doesn't wet the bed. She always tries to wake up the child who wets the bed. So she associates the difficulty in waking up the child with bedwetting. In fact, if she tries to wake up a child who doesn't wet the bed, she will find it just as difficult to wake up the dry child. So it is an interesting point and worth bearing in mind when using the alarms. So basically, as I said earlier, bedwetting is not an illness, it's not a disease, it's a natural process, and becoming dry is a skill which we acquire. And the problem is, as I said, you have 15% chance of becoming naturally dry per year, but you don't know when you are going to be dry. And obviously, especially in today's sort of societies, when mom is working as well, the burden of having to wash the sheets and change the bed is not, it's quite a burden, financially as well as physically. Having a child who, there is a risk as well of a child not doing very well at school or being teased and so on if found out. So it is obviously a very serious problem which deserves to be taken seriously. When it comes to dealing with bedwetting, obviously there are two ways of dealing with it. You can use drugs, and basically there are two classes or two types of drugs. One is an antidepressant, which has got one of its side effects that stops the bladder from contracting. So you are superficially appearing to be dry because the bladder is not contracting. And the other type is the antidiuretic hormone, which you could imagine if you take high enough dose of that, you will stop producing urine. So both of these drugs are basically trying to deal with the symptoms or trying to remove the symptoms, but not deal with the problem. In a way, you're trying to manage the problem, not to cure it. And this word management is being used now to mislead people, and it is really an admission that they are managing the problem or trying to manage the problem. So if anything, they reduce the quantity and frequency of the wetting, but do not cure bedwetting. And the minute you stop using the drug, the chances are the child will wet again. And it is, especially in today's financial environment, it is worth bearing in mind the cost of drugs, as some of them are as much as £40 per month, every month, until the child is naturally dry. That is if you're taking single dose. If you start taking double and triple dose, as you're advised, then the chances are you're going to spend thousands of pounds on drugs without actually achieving proper dryness. The bedwetting alarm, which is basically, bedwetting alarms have been used for over 100 years. And they initially were used to detect adults in a mental institution when they are wet, so they could be changed and prevent bed sores and pressure sores. To their surprise, the patients who were using the alarms became dry. So that is the birth of bedwetting alarms as such. And you can imagine there were sort of military-style metal boxes with wire mesh, so they were uncomfortable and quite complicated and difficult to set up and have chances of sort of false alarms and so on. The modern alarm is completely different. It's basically consists of a battery-operated buzzer attached to a sensor which will detect urine. So basically, that's what the alarm is actually a urine alarm clock, urine-triggered alarm clock. And they are battery operated. We have been making alarms. We have invented the body-worn alarm, and we've been making enuresis alarms for over 30 years. In fact, we have set the standard for the modern enuresis alarms. And as you can see, we have a large variety of alarms. Clinically, they are all just as effective. They all work in the same way, and they're all clinically just as effective. The different colors are different sounds, some with vibration, some with multi-sounds, some you could record the message on them, or music, or a phrase. So really the variation is to suit the user, but clinically they all work just in exactly the same way. And basically what the alarm is doing is actually telling the brain that the bladder is not under control. Once the brain is aware of the problem, it is the brain which will establish the link between the brain and bladder become established, and then it is the brain which controls the bladder, and the child becomes dry. So what the alarm is doing is actually speeding up the natural process and compressing these unknown lengths of years. If you like, if you have a child who is 5, you don't know whether they're going to be lucky enough to be cured next year or the year after, or sort of by the age of 13. So what the alarm is doing is compressing this unknown length of time into a maximum of 3 months. We know of children who are dry even much quicker, but we talk about 3 months maximum for a child to be naturally to become dry when they're using the alarm. And the way the alarm works, in a way, is similar. If you have to wake up at an early hour every day to go to work, say 3 o'clock in the morning, and you set your alarm clock, after a few days you find yourself waking up just a minute before the alarm clock goes. I'm not quite sure scientifically we can explain what the body is doing, what the brain is doing to program itself to wake up just precisely so close to the desired time. But the brain knows it's important for you to wake up, so it does the necessary programming to wake up at that time. When you think about the alarm, it's actually doing exactly the same thing, but in the opposite direction. The brain knows you are not supposed to wet the bed when you are asleep. So once the brain is aware of the problem, when the alarm sounds, as the urine and the sensation of passing urine is, the brain is aware of that sensation, then the brain does the necessary changes, so you become dry. So the alarm is basically making the brain aware of the problem, and it's the brain which will make you dry. And when you are using the alarm, you don't end up waking up just before you wet, or getting up frequently during the night to empty the bladder. You do not get up at all, and you don't wet. So you achieve dryness in the same sense as most of us achieve it. So it is actually a permanent cure. It's not something temporary measure to prevent wetting the bed. It's actually curing the bed. While with drugs, it's very often is trying to reduce the quantity of urine you release or the frequency of wetting, if they work at all. And most children don't even work. So that's a subtle difference between alarms. Alarms cure. Drugs, if they work at all, they are managing the problem but not curing it at a very high expense. As I said, the alarm is a battery-operated buzzer with a sensor. The best place to attach the alarm is somewhere near the shoulder on the pajama top or night dress top. Hence we use the safety pin, a nappy pin, to attach it, because there's no sort of sensible way of attaching it somewhere near the shoulder. The advantages of having the alarm near the shoulder is that it is comfortable when you are turning in bed. It's not digging into you. The sound is near the ear, so you are not being muffled by the duvet or blanket. And if the child did flood the bed, it's less likely for the alarm to get flooded. So it is a very good place to put it. You thread the sensor through the pajama top or the night dress, and you attach it to the outside of the underpants in the appropriate place where you feel it's going to get wet first, depending whether it's a boy or a girl. You fold the material, put it in the jaw, lower the lever, and that attaches the sensor to the underpants. And when the child starts to wet, the alarm will go off, and the child has to remove the sensor from the underpants and then press the reset button. This is intentional, so the child does wake up and remember the event. So the brain is aware of what's happened. We do have another sensor which can be used with inside a sanitary towel or sandwiched between two pairs of underpants also. And for people who still prefer to use bed mats, we do have a slimline bed mat which can be attached to any of the alarms, but obviously then you don't wear the alarm, you place it beside the bed or attach it to the mattress. The different colors are different sounds, as I said earlier. So, we are trying basically to be as helpful as possible, so a child will choose the sound they like or the color they like. The 8th sound, the yellow alarm, basically is for any child who claim they are getting used to the sound. So every time it's triggered, it's a new sound. And we have a vibrating only alarm that's purely for children with hearing problems or deaf, and tuned to waking up to vibration only. We have this range, the ultimate range. This has sound and vibration, And the advantage of using sound and vibration, apart from the fact you are getting two stimuli to start off with, is the ability to use it on vibration only. So as long as the child does wake up to vibration only, then if they are sharing the bedroom or if they need to use the alarm away from home, they can actually discreetly use it by putting it onto vibration only. And again, we have three single but different sounds, and the gold one is 8 sounds, and we have these 3 selectable ones where you could, apart from the sound and vibration and the random 8 sounds, you could select individual sounds if you wish. Then for children with special needs, autistic children, we have this range, the MO5 range, where you can, apart from having the sounds and vibration, you have the ability to record a message, music, a phrase which mum uses, so the child is aware of what's going on, and can be used obviously also if a child has got a mobile phone, you could record the tone of their mobile phone, and the chances are they will wake up to that to their mobile phone sound. So, but with whichever alarm you're using, it is vital for mum to help the child wake up when she hears the alarm for the first few nights until the child wake up themselves. So it is important to emphasize that. It's also important to emphasize that it's not, using the alarm is not an overnight success. It takes maximum of 3 months, but most children are dry long before then, before 3 months. But maximum within 3 months, we do expect the child to be completely dry, and that means over 14 dry nights consecutively. We do have also a wireless alarm, very new addition to the range. This one will fit, is a magnetically fits on the outside of the on the waistline of the underpants and attached to the outside of the underpants. And then when it's triggered, the receiver, which is away from the bed, will go off, and the child has to get up and switch it off. So we do have quite a large selection of different alarms, so that hopefully the child will select the one they like. Also, for some reason, some people do prefer to have the bed mat version. So we do have the bed mat and a bedside alarm. This one has got the ability to record a message or a phrase, if you like. We have volume control, as well as having the different sounds, or you could select individual sound. So this is quite flexible. You can also attach a vibrating unit to put under the pillow if you wish, or even you could have an extension to the parents' bedroom again if you wish. The major disadvantage, or main disadvantage of using a bed mat is the fact that the bed is going to get wet anyhow. So mum has to change the sheets, and the danger is if she doesn't change the sheets during the night, the child will wake up, go back to sleep into another dry bed, and the chances are mum will have 2 wet beds in the morning, which is not very encouraging to use the alarm. So they stop using the alarm. So as long as the parents or the mum is happy to use is aware of the problem, if you like, of having to make the sheets, make the bed, and change the sheets, then that's fine. You could, but I think it's a point which needs to be emphasized as well. This is mainly the alarms for use for nighttime wetting, for bedwetting. Some children at school basically too busy playing, and they forget to use the toilet during break times and end up wetting themselves while they're in the classroom. So for that problem, we have a vibrating watch, which you could program to specific times to coincide with break times, lunch times, and you could program it up to 12 different times. So the child, it's a normal watch in every sense of the word, it just have a vibration rather than sound, so the child is discreetly reminded to go and use the toilet, so when it vibrates. And that seems to be the most sensible solution for daytime watching. And we do have different colors, as again, to suit children's taste. So the golden rules are motivation. It is important for the child to be wanting to be dry. Obviously, nobody wants to wake up in a wet bed, but if the child is not bothered, then you need to find out if there is any other problem, maybe unhappy at school, or there's some problem. You need to solve that problem first. So the child needs to be motivated. You cannot help somebody who doesn't want to be dry. It is also important to explain that waking up to the alarm is a treatment. So ignoring the alarm, putting it away, not using it, is not the fault of the alarm. It is important for the child to wake up to the alarm. It's vital for parents to help the child wake up when they hear the alarm as well. So it's no good mom coming back and saying, well, everybody woke up and the neighbors, but not the child. It is vital for the parents to help the child wake up properly so they remember the event in the morning for the first few nights until the child starts to wake up by themselves. Very important for the child to drink as much as they like, no restriction of fluids, obviously water, juice, milk, and so on, but they can drink as much as they like. No lifting, so parents shouldn't, or mom shouldn't take the child while they're asleep to the toilet and empty the bladder before she goes to bed. No pull-ups or nappies, because again you're confusing the child. You're giving them the safety net, but expecting them to wake up. And just support and encouragement. And it's guaranteed to cure a child from bedwetting. Thank you.